Hello and welcome. History was in the making for all mankind with this medical advancement of a particular medication, antibiotics. What is the first thing that most people do when they get sick? They go to the doctor. What is usually prescribed? Antibiotics. I'd like to go into a brief history of the first antibiotic, as well as the key uses and 4 main reasons why doctors prescribe them. I'd also like to let you know the particular classes and ways of administering. Lastly, it is important to know how they work and how long to take them. So with that in mind, let's journey back to the year 1928, to the man who invented the first antibiotic. His name was Alexander Fleming. The word antibiotic comes from the Greek word anti, meaning against, bios, meaning life. So antibiotics are used against the life of bacteria. Some of you may be familiar with the first antibiotic being penicillin. Some of you may not be familiar with is that it was accidentally found in a mold culture. Now that we have a brief history, we can move into why they are prescribed. Antibiotics are used for only bacterial infections, which means the viruses such as the common colds or fungal infections such as ringworm, they will be useless against. The 4 main reasons why doctors prescribe antibiotics. The first is for conditions that are not necessarily dangerous or life-threatening, but will not go away without, such as severe acne, or conditions that are also not serious or dangerous, but can spread to others, like chlamydia, as well as conditions such as kidney infections or urinary tract infections, where the recovery time will be much quicker. Lastly, they are prescribed for those who are at great risk, such as people with pneumonia or cellulitis. They are also prescribed to prevent infections before surgeries. They're known as prophylaxis. Now that you are familiar with the uses for antibiotics, let's dive into the types and ways of administration. There are more than 100 antibiotics out there on the market, but they are all derived from very few main classes. There are 6 main classes of antibiotics. Some of you may be familiar with a few. There are penicillins, tetracyclines, as well as cephalosporins, aminoglycosides, macrolides, and fluoroquinolides. There are 3 forms which antibiotics are prescribed. There is the oral, which is commonly found in tablets, capsules, or even liquid form. Then there is the topical, which are creams, lotions, sprays, or drops. Lastly, there are injections, which is usually into the muscle or directly into the bloodstream. Now that you know the ways of administering and the reasons as to why, let's move on to how they work. The first thing is to know that they are used to kill, slow down, or stop the growth of bacteria. How you take the prescription is vital. Following the instructions is the key to the effectiveness of the antibiotic. An example is the instructions may say to take with food or on an empty stomach. The vital instruction of taking all medications, even if you feel better, is to finish the treatment prescribed. The reason is so that the body has a chance to heal itself, as well as if you stop before the treatment is done, it will not fully kill the infection, which may cause the infection to become resistant. The usual length of time depends on the reasons why you are taking them. A urinary tract infection may only take a few days. Pneumonia may take a few weeks. If you get an infection, killing it and feeling better is the goal. So if you're prescribed an antibiotic, it's important to take the full course. Alexander Fleming made a huge discovery that the medical fields, I'm sure, thanks him for. The fact that mold has helped in this advancement is amazing. The guidelines for the reasons for the prescription and the infection is also important. The severity to the individual and the prevention of the spread is the main concern. The 6 main classes and multitudes of possible prescriptions is astounding. The 3 ways the possible administration, oral, topical, and intravenous, it is hard not to have a solution to most infections. What is most important, though, is the patient follows the instructions given when it should be taken and finish the whole prescription. Each kind of infection varies in the time needed to take the medication. I hope you all learned a few things about antibiotics and the importance to the health and well-being of all. Thank you so much and have a wonderful day.